Welcome again, everyone, to the South Eastern Division second and interview with. I'm Karen Morgan, the Committee Manager for the South Eastern Division and the London Division 2. In the last update, we interviewed Dr. Hassanan Al-Tahir, who is the current Vice Chair of the Division and was previously our mentoring lead as well. In his interview, we discussed his roles in the division and the importance of these roles, as well as the work he had undertaken, in the hope that this helps you all understand the work that we do on your behalf. And today I'd like to welcome Professor Rafey Faruqui, who is the current chair of the South Eastern Division. Professor Faruqui has worked for the division over a number of years in different roles, and we are so grateful for his contribution and leadership. He is also the current chair of chairs for all the division chairs across England, a committee member of the Board of Trustees for the college, and a committee member of council. Professor Faruqui has also held numerous roles across the college, including chair of the neuropsychiatry faculty, a committee member for the Finance Management Committee, and a member of the International Advisory Committee, as well as a regional representative of the division. So he's been a very busy person on behalf of the college. Today we'll be discussing Professor Faruqi's role as a psychiatrist and his roles within the committee. Welcome, Professor Faruqui. Is it okay if I call you Rafey?
Sure, Karen.
That's really good. Thank you, Rafey. So I'd just like to take this opportunity of thanking you for joining us today and explaining the importance of your role within both mental health services and for the division. So let's get started on this interview.
Sure.
I have known you for a number of years now and know how busy you are working on behalf of the division and the college in various roles. So our first question is one that is always of specific interest to trainees, but what made you decide to become a psychiatrist and to specialise in neuropsychiatry?
Okay, thank you, Karen. First of all, choice of psychiatry as a career. It's a rewarding career. It brings aspects of mental health, physical health for a group of people who face lots of life adversities. In my opinion, it's culmination of your skills as a clinician, as well as your ability to look at illness or look at somebody's distress in a wider context, social context, how people live in society, and how different groups live as a population. So on an individual level, it's about career as a clinician. On a collective level, it's working with you, working with groups of people in order to change lives of people who come in contact with our services, and also lives of people who do not come into contact with our services, but we can influence services in a way so that they are looked after as well. Now, a few words about choice of neuropsychiatry as a career. I think, again, it is about the holistic health concept. I think neuropsychiatry as a subspecialty bridges the gap between medicine, between psychiatry, between neurology. We also work closely with other clinical specialties such as palliative care, for example, elderly care, and the rest. It is important to be able to look at people's distress, their behavior, and be able to make a link between brain and behavior. That's what neuropsychiatry is about. It is also about complex care, people presenting with multiple health issues. It's about making judgment on what needs to change in a person's presentation or in their lives for them to feel better, for them to have a better quality of life, for their symptoms to improve, for their rehabilitation to progress. And that is where neuropsychiatry is such an interesting area of psychiatry. And interesting area in the broad field of medicine.
Thank you, Rafey. That was really thought-provoking and inspiring. It's given us a good idea of what inspired you to become a psychiatrist. So our second question today is, describe your role as a chair of a division. What does this role actually entail?
Well, the primary role is connecting with people, okay, connecting with our members, connecting with trainees, connecting with lots of key stakeholders in a particular community or a region. That's what brings the change. Getting people to work together on projects that are helpful to our members, that are helpful to our patients, and are helpful to societies where we live in. So I will give some examples. There is a project that we are starting, working with Royal College of Psychiatrists Dean, with head of School of Psychiatry in South Kent, Sussex, and Surrey, and head of School of Psychiatry in West Midlands, and a number of other trainees and colleagues working across United Kingdom to look specifically at how induction processes and how support processes for international medical graduates should change. It is about developing standards, developing toolkits, and guiding future induction and future support structure of international medical graduates who come to UK for training, or graduates who are in UK, but for various reasons have to drop out of training or return to training during the course of their careers. It's about supporting the workforce to support excellent patient care. So that's one example. Another example, perhaps, is our effort in launching a health campaign on reducing alcohol-related brain harm. This is what we are working towards. So a lot of work is about mental health campaigning. It's about reaching out, again, connecting with people and driving initiatives that are able to bring about changes in population mental health. It is about reaching out, offering trainees opportunities to connect to these projects, offering colleagues in the region to connect with these projects, and then looking for the change that we wish to drive in Southeastern region, but also connecting with other regions in England and our devolved nations, working through College Council and working through colleges trustee board.
Thank you, Rafey. It's always good to see what motivates and inspires you to undertake roles for the division. So continuing on really from that, what were the three main reasons why you decided to become the chair for the South Eastern Division?
Well, it's about connecting, engaging, and organizing not only colleagues, but professional frameworks. Is driving an agenda that brings about change for patients with mental health difficulties in this region. It's about contributing to dialogue to improve health of population that lives in kind of this region. It's also about connecting with our international communities and other communities in United Kingdom. So it's an individual effort, but then the role allows me to connect with other individuals working in the region, but outside the region. The role allows me to connect with other groups. It enhances my ability and our division's ability to be more effective in what we wish to deliver. It's in a level, having the leadership framework that allows us to drive more.
Thank you, Rafey. I can see how this role keeps you very busy, but also can see how important it is to you and how invested you are in it. A chair has a huge responsibility, both with overseeing an executive committee, but also to its members. The tenure for a chair is 4 years. Now, this is quite a long question, so I'll say it slowly, Rafey. Can you tell us what were your three main areas to focus on when you took on this role and why? And as you've been in post for nearly 2 years, have these priorities or areas of focus changed? If they have, what caused this change of heart?
Okay, so I think one key area is connecting with the workforce and helping manage and boost their morale and motivation at a very difficult time of change and resource availability issues in healthcare. And that is very important. A motivated workforce and engaged workforce is able to deliver a lot more to their patients. So that's a key priority, and that remains. So engaging with colleagues, going out and giving talks, making myself available to receive comments, suggestions, and engaging with colleagues through a wide variety of mechanisms and forums. That's a key priority. The other priority that I had was population mental health and health campaigning. That has not changed, but the emphasis on it has changed. I think this is where probably I would like to give more time. So working with Royal College of Psychiatrists and my colleagues in University of Kent, we have recently won a NIHR Academy grant on developing a e-learning resource in population mental health research. The work has started. Okay, the funding has come through. I'm having my first meeting with my group of colleagues tomorrow. So hopefully we will deliver a very good e-learning resource for clinicians who are interested in population mental health. So that was a key aim, and I think that's a success. But in a way, success is not developing the resource. Success is actually seeing research agenda and population mental health agenda flowing through, working closely with the Center for Population Mental Health at the college, working with colleagues in council and working with colleagues in board of trustees. We would like to be able to develop more. I think I did talk about our aim to launch a mental health campaign on alcohol, reducing alcohol-related brain harm. But look, this is not where our journey had started. Our journey had started many, many years ago when I was asked to chair Intermedical Royal Colleges Committee on alcohol-related brain damage. That was a committee between Royal College of Physicians, Royal College of Psychiatrists, Association of British Neurologists, and Royal College of General Practitioners. That is where we produced the guideline on alcohol-related brain damage, very well led by my senior colleague, Professor Kenneth Wilson from Liverpool. Now we realize that the agenda has been successful. ARBD is recognized as a health condition that remains underserved. The pathway do not exist. We want to take it to a different level now. We understand that just talking about alcohol-related brain damage does raise the profile of the condition, but does not probably raise it enough for it to translate into mental health pathways, service commissioning, and a uniform approach to caring for these people. We want to upgrade what we had done. We want to upgrade it to reaching out to population and giving out the message that there is enough research evidence that can be translated into practice and how we can reduce alcohol-related brain harm. So in a way, it's again connecting, but it's not just about the topic. Okay, it's not just about what you are campaigning. It's about connecting with people, creating campaigns, but also then learning in return, learning to do things better. Okay, so that remains a priority. I think the focus is more sharpened, Karen, if I have to say. The third priority, again, and very close to my heart, is help improve training and lives of our trainees, is actually connecting with them. So I kind of run research groups where I work, okay? Our trainees are lifeline of those research groups. The message is that we run similar research groups in every trust. Okay. Now, again, connecting with college dean, connecting with other colleagues in UK, there is already a discussion on having a trainees research network. That is where Southeast Division is going to take lead in college. That is where Southeast Division is going to link with college officers and our other colleagues, and hopefully the research involvement of trainees will improve not only their training and their ability, but we will create a future generation of leaders and researchers who will work towards improving mental health care of patients in the community and internationally.
Thank you, Rafey. I know all of these projects you're very passionate about and are so important both to yourself and to the college, especially trainees. I know how the whole of the executive committee want to support and acknowledge the work that our trainees do across our region. And finally, Rafey, you'll be pleased to know, though being a chair is hard work, it is also rewarding. Can you tell us what you have personally achieved from undertaking this role and why you would encourage people to join the executive committee?
Okay, I think I'm more reflective as a person. Okay, connecting to people and reaching out also helps you grow as a person. I know more about difficulties our trainees our members face in their professional domains. I know about their successes. I've learned new skills. Okay. I would encourage colleagues to come forward, join the executive committee, or be part of one of our projects or discussions, depending on how much time do you have. It's a rewarding process. It's creating change not only in lives of members, but it's creating change in lives of services where we work and in lives of our patients. That's the ultimate aim. It's a rewarding experience, shall I say.
Thank you so much, Rafey, for sharing your motivation and inspiration in not just providing mental health care, but in also taking up roles within the division and the college. We really appreciate the time you've taken to do this, and we hope this is not only provides an overview of your roles within the executive committee and the college, but also how important the committee is in supporting psychiatrists. I hope you've all enjoyed this interview today and can see how exciting and worthwhile it is to be part of the division's executive committee and lead on the strategic direction for its members. I look forward to sharing more roles within the executive committee soon. Take care, everyone, and goodbye.
Thank you. Bye.